Welcome, welcome everyone to the 2024 WIC immunization webinar. My name is Cerise Murata. I am the Director of Advocacy and Education here at Vaccinate Your Family. We are very excited about this annual webinar, and we're going to get started in just a minute. We're just going to give folks a couple minutes to log in. It is just 1 o'clock, and we will start promptly in about just a few seconds. We hope everyone is staying happy and healthy during this time of year as we all start to gear up and prepare ourselves for the fall and winter respiratory season. Hello, everyone. Welcome, welcome to the 2024 immunization webinar. We're going to just give folks a minute to get loaded in here, and then we're going to get started. Again, my name is Cerise Murata. I am the Director of Advocacy and Education here at Vaccinate Your Family, and I will be your host and moderator for today's immunization webinar. Okay, so let's get started. We here at Vaccinate Your Family are so excited. We have been working with USDA and CDC and others in the space around WIC for, oh gosh, over a couple decades now. So this is very near and dear to our heart. What you folks do as WIC staff is so extremely important. You are serving millions of people every day, every year. So first, I just want to start off with saying a huge thank you. You guys are phenomenal in the work that you do. And whatever we can do here at Vaccinate Your Family and USDA and the National WIC Association and CDC, whatever we can do to support you, that is what we're here for today. So let's go ahead and get started, and we will go over our agenda for today and then jump right into it. So love, if you want to start sharing the slides, that would be great. Thank you. Wonderful. Well, again, welcome everyone to the 2024 immunization webinar. So let's go to the next slide and talk about our agenda. What do we have in store for you today? Well, we have some really wonderful, super important partners on our call today. First, I'm going to give you an introduction about Vaccinate Your Family and the organization. Some of you may be familiar with us, but if not, we just wanted to level set there. And then following that, we will have a welcome from the USDA, followed by a welcome from the National WIC Association, and then a presentation by some folks from the CDC's Immunization Services Division, when they're going to be giving us a lot of information today. So never fear, this is being recorded, so we will be sending a recap email with all of this information, but we will be talking about things like vaccine recommendations and updates to those recommendations for children and pregnant people, recent disease outbreaks. Unfortunately, we are continuing to see those. We'll talk about the 24-25 respiratory season. And what do we have in store for us, right? It seems like we just came off of the last one, but here we are going into the next one. And then we'll talk about getting back on schedule with routine immunizations and CDC's Let's Rise campaign and what they're doing over there on that end. And then almost most importantly here for you folks is how can we help support you folks as WIC staff to be vaccine champions? So just a quick housekeeping note, we do encourage everyone throughout the course of the presentation here today to please feel free to enter your questions into the Q&A box, which you should see at the bottom of your screen. We will have time at the end for Q&A. So if you could put those in there, that'd be wonderful. We will be looking at the chat, but not monitoring it as closely as the Q&A box. So let's move to the next slide, and I'll give you just a very brief overview of Vaccinate Your Family and our organization. So we have been around for over 30 years. We are a national nonprofit organization that actually was founded by former First Lady Rosalind Carter. and a former First Lady of Arkansas, Betty Bumpers. And you see a picture of these lovely ladies on the left here. So these ladies joined forces decades ago as governor's spouses. And one of the things that they were incredibly passionate about was increasing vaccination rates in their own states. So that's where they started. They continued that work through the Carter administration and the 1980s, and they were really instrumental in boosting federal support for vaccine programs and state laws. So in the 1990s, some of you may remember we had a measles epidemic in 1991. We're experiencing outbreaks now. We'll talk about that later. But that was really a catalyst for Mrs. Carter and Mrs. Bumpers to found this organization, which began under the name of Every Child by Two. So these ladies traveled to all 50 states to promote vaccination, as well as internationally. These ladies are just powerhouses. And they actually initiated the Vaccines for Children program and ensured immunization screening for WIC recipients. So we owe a lot of our kudos to these ladies. They were groundbreakers, and we are very honored here at Vaccinate Your Family to continue to work in their honor, as well as all the other folks that are doing this work in the immunization space. So Vaccinate Your Family was very instrumental and pivotal also in the early 2000s when we started seeing a lot of anti-vaccine sentiment. So that is something that we have been focusing on since then. Vaccine confidence, vaccine hesitancy, and addressing all the things that go along with that. So we eventually transitioned from Every Child by Two to Vaccinate Your Family. So we're looking at all vaccine preventable diseases across the lifespan. And that is our mission. At the most simple way to put it is we work really hard to protect people of all ages from vaccine preventable diseases. Next slide, please. So what we're going to share with you today is a bunch of resources because again, it's all about you guys. It's all about WIC staff and how can we help you serve your clients. So we have several resources that we have updated again this year in 2024. Some of them you see here on your screen that are geared towards you as WIC staff. Some of these resources are geared towards your clients, like our immunization packet for parents and parents-to-be. We also have an online lesson for WIC that is also for WIC recipients. So we'll talk about that a little bit later in the conversation. And we will also be dropping into the chat some links to those resources as well as others. Again, don't feel like you have to furiously write all of this down because we are going to be sending out a recap email to everybody at the end, which will probably hit your inbox at some point next week. Next slide, please. So this is just some of our other resources we have here at Vaccinate Your Family, which you'll hear us talk about a little bit later. We have some ebooks for children and teens as well as adults. And we will share links to those as well, but it's a really handy resource for you guys to have in your offices and handy when you're talking with your clients. We also have a Paying for Vaccines tool that we will share in our resource list as well. If you happen to have, most presumably, clients who are underinsured, uninsured, or really just struggling to find out how do they pay for vaccines. You're navigating them to vaccines, and probably one of the concerns that they may have is, where do I find them and how do I pay for them? So with that, let's go to our next slide. And we are going to launch our first poll. So you should see popping up on your screen right now a poll that asks a series of questions. And we'll have a poll at the end of the webinar as well. So we would like you guys to answer these on a scale of 1 to 10, or excuse me, 1 to 5. 1 being not at all important to 5 being extremely important. Question number 1. How important do you think it is to vaccinate children against diseases such as measles and polio? Question number 2. How important do you think it is to vaccinate children against respiratory diseases like COVID, RSV, which is respiratory syncytial virus, and flu? Question number 3. How important do you think it is to vaccinate pregnant people against respiratory diseases like COVID, RSV, and flu? And number 4, how confident do you feel in your ability to talk to clients about vaccines, which we know is an important part of your job? So we'll give you folks just a few more seconds to hopefully populate that poll. And then as we're doing that, I am going to be introducing our first important partner here for our WIC program, and that is Kristin Garcia from the USDA. And then I'm going to turn it over to Kristin to do some welcome remarks. But first, her bio. So Kristin Garcia has more than 20 years of experience in public service as a public health professional. Currently, she serves as the Director of Food Safety and Nutrition for the Supplemental Nutrition and Safety Programs at the United States Department of Agriculture, also known as the USDA, Food and Nutrition Service. In this capacity, she leads activities to support WIC program nutrition education and nutrition services policy, regulations, and legislation, including the WIC food packages and breastfeeding promotion. So I would like to welcome Kristin to give some opening remarks. Kristin, floor is yours.
All right. Hi, everyone, and thank you, Cerise. I just want to thank everyone again for joining us today. We at the USDA are grateful to Vaccinate Your Family and our CDC partners from the Immunization Services Division for their partnership and for presenting this webinar to update all of us about vaccines. Offering information to WIC participants about the importance of immunizations and providing referrals to immunization services has been a part of WIC since the program's inception. And it was really cool to see the intersection there of kind of the history of Vaccinate Your Family with the former First Lady and Governor's wife. And WIC is in a unique position to disseminate information about why immunizations are critical in ensuring health, since we come into contact not only with participants, but also with caregivers, parents, siblings, and other friends and family. And WIC staff encourage parents to bring their child's immunization record to WIC appointments so they can screen the record as part of the WIC certification process and provide a referral as appropriate. And as a result of these efforts, your efforts, immunization rates for children participating in WIC have greatly improved. Remember, you can access educational materials and immunization resources for WIC via the WICWorks resource system at wicworks.fns.usda.gov. And this includes WIC's minimum screening and referral protocol, which also links to the Vaccinate Your Family website. Today's webinar will be especially helpful in raising awareness and answering questions that you may receive. And we encourage you to share this information not only with WIC participants, but with friends, colleagues, neighbors, and family as well. On a personal note, I'm just kind of interested in hearing about the 24-25 season, respiratory illness season. My daughter, I have two kids, but my daughter who just turned 12 last week, had a rough go at the start of school with, she had pneumonia coupled with strep, and we're going in today actually to get her flu vid vaccine. So excited to do that. And with that, I'll turn it back over to Cerise and hope that you all enjoy the webinar today. Thanks so much for joining.
Thank you, Kristin. And I'm so sorry to hear that your daughter had a rough start, but so important to share our personal stories, right? Like, thank you for making sure to put that at the top of your list. And we should all be, if we haven't already, putting it on our list as well. So next, I would like to introduce Darlena Birch from the National WIC Association. So Darlena's WIC journey commenced at the grassroots level within a local agency serving an 8,600 resident rural community along the Arizona-New Mexico border. Progressing from a role as the agency's WIC director and registered dietitian, Darlena ventured to the Arizona WIC state office in Phoenix. Her drive for growth led her back east, where she served as the training center nutritionist with the Maryland WIC state office. Currently, Darlena oversees NWA's nutrition and breastfeeding initiatives, contributing to advocacy efforts, crafting public comments, and contributing her expertise in the evaluation of research and studies pertaining to nutrition and breastfeeding. So Darlena, I yield the floor to you for opening remarks. Thank you.
Good afternoon, everyone, and thank you so much for attending this vital webinar. My name is Darlena Birch, Senior Manager of Public Health Nutrition at the National WIC Association, and it's my honor to welcome you to this important webinar that discusses the vital role that vaccinations play in ensuring the health and well-being of the public. As the premier public health nutrition program, WIC is instrumental in not only providing nutrition education, breastfeeding support, and supplemental foods to participants, but WIC also provides referrals to health and social services, including vaccination referrals. Given that access to vaccinations are an essential aspect of public health, WIC staff play an integral role in making sure participants are aware of their own vaccination needs. Not only do vaccinations improve the health of program participants and the public at large, but they also reduce health equity issues. As the nonprofit voice of the 12,000 public health nutrition service provider agencies and the over 6.7 million mothers, babies, and young children served by the Special Supplemental Nutrition Program for women, infants, and children, NWA provides education, guidance, and support to WIC staff and drives innovation and advocacy to strengthen WIC as we work towards a nation of healthier families. NWA values our partnership with Vaccinate Your Family and USDA's Food and Nutrition Services, along with the Centers for Disease Control and Prevention on this important issue. Thanks.
Thank you, Darlena. Thank you, thank you. And again, we are so honored to partner with NWA and USDA on these efforts and CDC. So I'm going to now introduce our partners from CDC Immunization Services Division. So first we have Kathleen Holmes. Kathleen Holmes is a senior public health analyst in the Immunization Services Division at the CDC. She coordinates Let's Rise, which is the division's initiative to understand and address pandemic-related declines in routine vaccinations. Prior to joining the Immunization Services Division, Ms. Holmes spent a decade working in various positions at CDC and holds her master's degree in public health from Emory University. Then also from CDC ISD, we have Dr. Evelyn Twentyman. As Senior Advisor for Vaccine Strategy for CDC's Immunization Services Division, Dr. Twentyman coordinates multiple efforts across CDC to expand equitable access to vaccines and to equitably reduce the burden of vaccine-preventable diseases nationwide. As part of these efforts, Dr. Twentyman led CDC's Bridge Access Program for COVID-19 vaccines, which provided no-cost COVID-19 vaccinations to adults in the United States without health insurance and to those whose insurance does not cover COVID-19 vaccination. Dr. Twentyman has served in numerous leadership roles previously, including as Chief Medical Officer of CDC's COVID-19 Response Vaccine Task Force and as CDC lead of the Advisory Committee on Immunization Practices Working Group on COVID-19 Vaccines. So now I introduce Kathleen and Dr. Twentyman to share with us their presentation for today's webinar. Thank you.
Great. Good afternoon, everyone. Thanks so much for having us. I'm excited to have the opportunity to talk with you today about childhood immunization and opportunities to strengthen immunization coverage to help protect children against vaccine-preventable disease cases and outbreaks. Next slide. Keeping up to date with vaccinations is one of the best things that parents and caregivers can do to help protect children from serious illness, hospitalization, and death. Immunizations are especially important for children under 5 years of age because their immune systems have not yet built up the necessary defenses to fight infection, making them even more susceptible to disease. Vaccines provide children with protection against more than 15 diseases noted here, including measles, mumps, diphtheria, and polio. Vaccines have been so successful that many of the serious diseases that were once common among young children are now practically unheard of. And we're working at CDC to keep it that way. Next slide. So I'll start today by providing an update on the state of routine childhood vaccinations. Childhood vaccination coverage for children 24 months of age has remained stable in the United States for many years, as seen by the fairly flat coverage lines across all vaccines between 2011 and 2018. In the wake of the COVID-19 pandemic, disruptions in routine health services resulted in declines in well child visits and, in turn, routine vaccination coverage. When looking at this figure, which has birth years noted across the bottom, you'll note that national coverage remains stable for most children, even those born after 2018 that reached 24 months of age during the pandemic, meaning that initial declines were temporary and most children were able to catch up on their vaccinations. The one exception is for flu vaccination, which can be seen in the dashed gold line. Influenza vaccination coverage increased among children of all age groups in the season just prior to the COVID-19 pandemic, but declined after the pandemic began and have not yet rebounded to pre-pandemic levels. Next slide. And while national coverage rates have remained stable overall, routine immunizations fell among certain groups of young children and have not yet rebounded. 7 series vaccination coverage declined by 5 percentage points among children living in rural areas in the 2 years following the onset of the pandemic, further increasing the coverage divide between rural and non-rural areas, which was 1.5% different prior to the pandemic and is now 6.5% different, meaning that vaccination coverage is now 6.5% lower among rural children than their peers in suburban and urban areas. A similar decline in widening disparities in 7 series vaccination coverage was also observed among children living in poverty as compared to those living above poverty. Kindergarten vaccination coverage also declined nationally from 95 to 93% during the 2 school years after the onset of the pandemic, and declined by as much as 10% in some jurisdictions. It remains at its lowest coverage level in decades this past school year. And these declines in kindergarten vaccination coverage translate to an estimated 725,000 children that entered kindergarten during the pandemic, even after schools returned to in-person learning, who are potentially susceptible to vaccine-preventable diseases. Next slide. It's also important to note that in addition to these recent declines, long-standing inequities in routine childhood vaccination coverage that existed prior to the pandemic continue for children in racial and ethnic minority groups and children who are uninsured. For example, in 2023, the percentage of uninsured children that had not received a vaccine by their 2nd birthday was 8 times higher than among privately insured children. Next slide. So what are the implications of pandemic-related declines in childhood vaccinations? Unfortunately, it's an increase in outbreaks of vaccine-preventable diseases. In Europe, a very small decline in MMR vaccination coverage, ranging from 1 to 3 percentage points, so very similar to what we saw here in the United States during the pandemic, has resulted in a 45-fold increase in measles cases by the end of 2023 as compared to 2022. On the slide, it notes a 30-fold rise in measles cases, but that was actually as of the fall of 2023. So by the end of the year, it had increased to a 45-fold increase. Next slide. So the US is now also experiencing a rise in measles and whooping cough cases and outbreaks. As of September 12th, 251 measles cases have been reported this year. And to put this into perspective, this is more than quadruple the number of measles cases reported in all of last year, and led CDC to issue a health advisory alert earlier this summer. Next slide. I think because vaccine-preventable diseases are rare today in the United States, we sometimes forget how serious they can be. Measles, for example, is one of the most contagious respiratory diseases. And contrary to what we hear on the news these days, It's not simply a rash or a fever. Measles can cause brain swelling, pneumonia, and can be life-threatening, especially for young children and babies. In fact, over 40% of the individuals that have contracted measles this year have required hospital care. The good news is that the MMR vaccine is highly effective in protecting children and adults against measles. Next slide. Now I'd like to turn it over to my colleague, Dr. Twentyman, to discuss fall respiratory.
Thank you so much, Dr. Holmes, and thank you everyone for having us here today. Thanks especially to the WIC staff that are on the line. Public health is very much a team sport, and we could not do this without you. Your close contact with families in communities and the trust that they have in you is so powerful in helping us get the message about vaccines and their importance out into our population. So seriously, thank you for your time and being here today. What I'm going to tell you today is essentially that we need your help more than ever. And that is because, as you'll see in my presentation, I'm going to split this into like a bad news half and a good news half. The bad news is our populations that we serve, the families that you serve, remain at high risk in this upcoming respiratory virus season. The good news is that the vaccines we have reduce that risk significantly. So what I'm going to do is I'm going to show you that the risk of these respiratory viruses remains. I'm going to show you that respiratory virus season remains a serious threat to the health of our families that we serve. Then I'm going to talk about some groups that are at even higher risk than our average American population. Then I'm going to talk about what we can do about that, what we can do to help protect the families that we serve. I'm going to talk about what vaccines that we have to protect us from the respiratory virus season, and then go over what our recommendations are for them so that when you see the families you serve, you can say, hey, I think you might be due for this vaccine. Why don't you talk to your healthcare provider about that? Okay, so first, starting with the bad news. Fall and winter respiratory viruses remain prevalent. The stakes, therefore, remain higher than before the pandemic. And some of you might think like, what? I thought that COVID-19 was getting better. It is lower than previous years, but there are still many hospitalizations from COVID-19. And unfortunately, influenza and respiratory syncytial virus, that is to say RSV, are back to their full strength following the decreases of flu and RSV that we saw during the pandemic. So what does that mean? Next slide, please. That means that even a moderate virus season can be worse than a severe pre-pandemic season. And this is what I mean. So if you look at the first bar on this graph, you see the 2017 to 2018 flu and RSV season. Now, bear in mind, this is before the existence of COVID-19. Wasn't that a great era? I missed that. So you can see that the peak hospitalizations reached a rate at a little over 10 per 100,000 in that respiratory virus season. Then the next bar is the 2022 to 2023 COVID-19 and flu and RSV respiratory virus season. You can see like, wow, that pandemic made a huge difference. COVID-19 really made hospitalizations go up. Then you see it go down a little bit as we develop more immunity to COVID-19. But what does that mean as we go into this season? Well, what that means is the modeling experts that put this together for us expect that peak hospitalization burden will be similar to or lower than last season. But even if it's a bit lower than last season, that is to say the third bar here, you can see it's still higher than what we used to see. So our collective risk is still higher than it was before the pandemic. Next slide, please. Thus far, we've just talked about hospitalizations. What I want to show here is that death remains a threat too. So this is not good news, but in the last season, RSV claimed the lives of 6,000 to 12,000 Americans, flu 25,000 to 72,000, and COVID-19 76,000. And we've already talked about the many hospitalizations associated with each of these. Overall, in our last respiratory season, over 1 million Americans were hospitalized and over 100,000 died during the respiratory virus season. Additionally, RSV is the #1 reason for infant hospitalization in the US, and we'll get into that more into that shortly. But this is why your help is so badly needed. Our populations that we serve still need help, still need protection from these deadly diseases. Next slide, please. So who's at increased risk for these respiratory virus diseases this season? Who's at increased risk for COVID-19, flu, and RSV? That group includes our older adults, our young children, people with compromised immune systems, people with disabilities, people who are pregnant, and often racial and ethnic population groups as well. So we need to be bearing them in mind. Next slide, please. And now to touch a little bit more on RSV. Guys, RSV is the leading cause of hospital stays for infants in the US. RSV is unfortunately really common. Most infants are infected in their first year of life. Nearly everybody is infected by 2 years of age. And in the absence of immunization, 2 to 3% of young infants will be hospitalized for RSV disease. The younger you are, the more vulnerable you are. The highest RSV hospitalization rates occur within the first month of life, and risk does decline with increasing age. But we can't totally predict who will get sick. Almost 80% of children hospitalized with RSV under age 2 years had no underlying medical conditions. 4 out of 5 infants hospitalized with RSV under the age of 2 years had no underlying medical conditions. Okay, so thus far, this presentation has been pretty grim and talked a lot about risk, talked a lot about who's at increased risk, but what can we do? Next slide, please. Now on to the good news and the reason that we need your help here today. Vaccines cut the risk of severe disease by half or more. COVID-19 and flu vaccines cut the risk of hospitalization in half in all ages. Additionally, COVID-19 vaccine is the best available protection against long COVID. Nobody wants that. RSV vaccines help prevent older adult RSV hospitalizations. They're associated with 3 times lower risk of hospitalization than those who do not have vaccination. And there is a super cool monoclonal antibody for infants called nirsevimab, which reduces the risk of infant RSV hospitalization by 10 times. So y'all, we have some very powerful interventions, and we so appreciate the interface that you have with the families that you serve so that you can help spread the good news about vaccines and what they can do for us and for our families. Next slide, please. So what are our vaccine recommendations as we head into this respiratory virus season? How can we protect ourselves? Okay, for COVID-19 and flu, it's actually super simple. So that's a real easy one to go over, and then we'll dive into RSV a little bit more. For COVID-19 and flu, anybody ages 6 months and older needs an annual vaccine, needs a COVID-19 shot, needs a flu shot. Those are our recommendations, real clear, real simple, real easy to follow. Now for RSV, let's get into that a little bit more. As you recall, it's a very powerful form of protection against RSV severe illness and hospitalization. And with that comes a little more complexity as we've got different products for different ages. Next slide, please. So who should get RSV hospitalization? Let's go in order of age here. So we have 2 ways of protecting infants from RSV. One is maternal RSV immunization, and second is nirsevimab. So all infants under age 8 months and children ages 8 through 19 months with risk factors should get nirsevimab if their mother was not vaccinated with maternal RSV vaccine. Ideally, it's during the respiratory season that they get this, but they can also get this anytime. Now let's turn to mom. So people who are pregnant at 32 to 36 weeks gestation should get RSV vaccine, and that's a specific vaccine. That's the Abrysvo vaccine, and we want to offer that during the respiratory season. So that's, and a little bit before, so that's September through January. Adults ages 18 through 59 don't need a RSV vaccine if they're not pregnant. In other words, if they don't have a fetus to whom they can pass these antibodies from these vaccines. And then for older adults, all adults ages 75 years and older, and adults ages 60 through 74 years with risk factors should get one lifetime dose of RSV vaccine. And there are many risk factors, so I would just encourage you to encourage the people that you serve. If they're ages 60 years or older, I would just advise them to ask their healthcare provider if an RSV vaccine is right for them. Okay, so with that, we've talked about the risk that the respiratory virus season continues to pose to the families, the communities, the populations that we serve. And we've talked about how powerful the vaccines that we have against COVID-19, flu, and RSV are to protect the populations we serve as we go into this season. So again, I really want to thank you for your time and for your help and for your interface with these important families and communities. Thanks for everything that you do to get these folks protected. And with that, I'm going to hand it back to Kathleen. Thanks.
Great. Next slide. So acting quickly to get recommended childhood immunization coverage back to pre-pandemic and target levels is a leadership priority for CDC to help prevent outbreaks of vaccine preventable diseases. And through our Let's Rise initiative, we are working to advance catch-up by developing numerous calls to action, communication assets, and multiple partner toolkits to help facilitate the work that our partners like you are doing. Next slide. So we're working with a number of different partners, including healthcare providers, health departments, schools, early care and education professionals, and programs that engage families directly like yourselves to amplify immunization messages and connect families with access to vaccines. Next slide. We are also reaching out to parents and caregivers directly via paid digital ads and social media with our new Keeps It That Way communication campaign. The campaign is informed by focus groups that we did this past year with parents of young children in the general public and those living in rural areas specifically, which revealed that many parents lack knowledge around individual vaccine preventable diseases and the associated health risks and want to know more. It's meant to provide information about these diseases and the vaccines that prevent them in a fun, creative, and non-judgmental way. And we have plain language fact sheets about the diseases and the vaccine schedule and are working to translate these materials into multiple languages. And all of these materials are adaptable and unbranded for use by our partners. Next slide. We're also working across HHS to increase awareness of, confidence in, and uptake of vaccines that protect us from severe illness from respiratory viruses. One example of this is the HHS communication campaign, which will deliver research-based messages through a variety of platforms and is working with partners at the national, state, and local levels to ensure that everyone has access to information about vaccines that can help them avoid illness. Next slide. So I'd really like to echo everyone in applauding and thanking you for all of the work that you do to support families, including strengthening vaccination coverage. As Dr. Twentyman just said, we really do need your help and see you as a key partner and a trusted messenger in strengthening childhood routine immunization rates. As everyone has mentioned here today, WIC has incredible reach. You serve nearly half of all infants born in the United States through thousands of clinics throughout the nation. And this wide engagement really allows you to have a huge megaphone to amplify nutrition and health messages. You're part of the community you serve and have established relationships with the families with young children, and specifically families living under the federal poverty line that have the lowest routine childhood immunization coverage. and thus are most vulnerable to vaccine preventable diseases. And the important role that you play is clear. Children enrolled in WIC are more likely to have regular source of medical care and be up to date on their immunizations. Next slide. So on this slide, I've listed what we think are some opportunities for you to be vaccine champions and take action to further enhance strengthening childhood routine vaccination coverage among children 0 to 5 years of age. First, WIC programs can help ensure that staff have up-to-date vaccination schedules, access to immunization resources and trainings like the one that we're doing here today, and help answer staff's own questions about vaccines. If you are vaccine hesitant, it's hard to strengthen vaccine confidence among the families you serve. WIC programs can help share resources and factual vaccine information with families as a part of new client packets, and can also help keep vaccination top of mind among families by displaying vaccine materials like posters or flyers in the waiting room or WIC rooms. For WIC staff, we ask that you please continue to check if a child is up to date on their vaccinations at every encounter with a family member or caregiver, answer caregiver questions, make strong vaccine recommendations, and support families to find and access free vaccines. And finally, please remind caregivers to bring vaccine records to every meeting. Next slide. So if caregivers do not have their child's immunization card, please again remind them to bring them to their next visit. And also offer to answer any questions that they have about vaccines or the recommended vaccine schedule. Next slide. So really, for the rest of my presentation today, I'd like to provide some resources that are meant to help you to support the families that you serve, and to also help support you to feel comfortable in engaging in vaccine conversations. Next slide. So CDC publishes a parent-friendly vaccination schedule that you can reference or print. It's the image noted on the left of the slide and contains all ACIP recommended childhood vaccines for children 0 to 6 years of age. And you'll see those vaccines down the left column and ages that children should get these vaccines across the top. So as an example, children are recommended to get 2 doses of the MMR vaccine, which again protects children against measles. Children should get their first dose at 12 to 15 months of age and a booster dose prior to starting kindergarten at 4 to 6 years of age. Another resource that we have, which you'll see on the right, is a Grows Up Healthy poster. And this poster goes through child development milestones and recommended vaccinations by age for children 0 to 5 years of age. And we are offering up to 10 free posters to FQHCs and to WIC clinics. So if you are interested in receiving a free Grows Up Healthy poster that you can put up in your clinic, I will be providing information in the chat about how you can order these directly from CDC. Next slide. So if you or your clinic would like support around engaging the caregivers that you support and serve in vaccine conversations, we have a guide entitled Talking to Recipients About the COVID-19 Vaccination. Although this guide was actually developed for the COVID-19 vaccine, the conversation techniques are vaccine agnostic, meaning they could be really used for any vaccine conversation that you're having. And the techniques that the guide covers include asking open-ended questions to explore a caregiver's concerns, asking permission to share information, helping a caregiver find their own reason to get vaccinated, offering to continue or revisit the conversation at your next meeting, and helping caregivers to access free vaccine for their child. Next slide. We also have additional handouts that you can use or share with caregivers around why it's important to vaccinate, around vaccine safety, commonly asked questions, and what to expect from their child's immunization visit. Next slide. And one of the most common questions that we receive from our immunization stakeholders and partners is how to address vaccine myths and disinformation. And this could really be a whole webinar in and of itself. But I'll mention here today, as I previously noted around the conversation techniques, I think it's really important to start coming from a place of empathy and recognize that parents want to do what they think is in their child's best interest, and that we live in an era where there is a lot of information and it can be hard to know which information sources are accurate. So I think in addressing misinformation, it's really important to start by listening and trying to understand the caregiver's concerns. You can also ask if you can provide information and explain where your information source comes from and where they can find additional credible sources of information, such as on the parent handout developed by immunization.org on the right, or by talking to their healthcare provider. And when addressing misinformation, we recommend using what's called a truth sandwich, which is where you start by stating the fact, and then you can address the misinformation, and then you again end by stating fact. And as always, you can tell the families that you serve to follow up with their healthcare provider if they have additional concerns that they'd like to discuss. Next slide. So the federal government does offer free vaccines through the Vaccine for Children's program to help families who cannot afford vaccinations. For those who may not be familiar on this call with the Vaccine for Children's program, each year, approximately 59% of vaccines that are routinely recommended for children are purchased through this program. There are over 24,000 providers in the United States that participate in the Vaccine for Children's program in more than 13,000 sites. And children are eligible for the Vaccine for Children's program, again, to receive free vaccinations if they are 18 years of age or younger and qualify for Medicaid, do not have insurance, or are American Indian or Alaska Native. So a majority, if not all of the families that WIC serves should be eligible for free vaccines as a part of this program. Next slide. And we recommend not just telling families that they qualify for free vaccines, but also help them locate a Vaccine for Children's provider. If your WIC clinic does not sit within an FQHC and a family doesn't have a medical home already, in many states, you can look up VFC providers in your area via your state health department website or by contracting your local health department. And I've put together this slide to help facilitate looking up your local VFC providers. So where you see hyperlinks, these are jurisdictions that have websites with public lists of VFC providers or interactive maps as to where they're located. Next slide. So vaccines.gov also remains a trusted resource to help adults find pharmacies where they can get vaccinated. Next slide. Additionally, we've developed this handy one-pager for WIC staff, which is available both in English and in Spanish by scanning the QR code on the slide. And if you take nothing else away from my presentation today, it's to download this one-pager, which will direct you to a wealth of strategies and resources that you can use to serve your clients and help strengthen routine childhood vaccination coverage. And resources on this one-pager include CDC parent handouts, information about the Vaccines for Children's program, and links to a companion partner toolkit. Next slide. And if your WIC program is looking for communication assets, you can check out CDC's communication and print resource webpage for free downloadable branded and unbranded materials, such as posters and social media content that you can use in your clinics. And the URL to this resource page is noted at the bottom of the slide. Next slide. So in summary, routine immunizations fell during the COVID-19 pandemic among certain groups of children and vaccines and has not yet rebounded. It's not too late to protect our communities. The United States has a strong immunization program, and we have the infrastructure to catch up declines in routine vaccination coverage that have resulted from the COVID-19 pandemic. We're also in our strongest position yet to protect our communities this respiratory season through immunizations, rapid tests, effective treatments, and other preventative actions to help protect against flu, COVID-19, and RSV. Strengthening routine childhood immunization coverage is a goal that we can achieve by working together. Thank you, and Dr. Twentyman and I would be happy to take any questions that you have during the question and answer period.
Thank you so much, Kathleen and Evelyn, for that wonderfully robust presentation. So much great information, and I think we'll be able to hopefully share your slides as part of the recap email that goes out to participants. So next, we're going to launch our post poll. So you're going to see those questions come up on your screen there. And love, if we could just bring that slide back up too, as we give people time to work through those questions. So next slide, our post-poll questions. There we go. So on a scale of 1 being not at all important to 5 being extremely important, question number 1, how important do you think it is to vaccinate children against diseases such as measles and polio? Question number 2, how important do you think it is to vaccinate children against respiratory diseases like COVID, RSV, and flu? Question number 3, how important do you think it is to vaccinate pregnant people against respiratory diseases like COVID, RSV, and flu? Next slide. Question number 4, how confident do you feel in your ability to talk to clients about vaccines? And for question 5, this is going to be a simple yes or no. Do you plan to use the information or resources presented during today's webinar? I know we have presented you with a lot of resources, so hopefully you found something that spoke to you during that wonderful presentation by Kathleen and Evelyn. Question number 6 is just open-ended question. What additional support or resources would help you champion vaccines with your clients and in your community? So I think all of us cumulatively are putting forth resources, but is there something perhaps that we didn't talk about today or you have top of mind that you thought this would be really great? We don't have it, we need it. Please enter that into the poll. And we'll leave that open for just another few seconds here, and then we will move into our Q&A. And just a reminder, we've got 5 questions in our Q&A box right now, but I encourage you to add any additional questions you might have. And then I'll ask Kathleen and Evelyn if you could come back on camera, because I imagine that you will be answering most of the questions that we have in our Q&A.
We're happy to.
Wonderful. Okay, so hopefully everybody had enough time for to complete the post poll. We'll go ahead and close that, and we will move on to our questions. So, first question. This may be addressed later, but what are some ways to engage clients who believe vaccines cause autism or other developmental conditions? I know that's a big one. Kathleen and Evelyn, I defer to one of you to take on this robust question. I know it's on a lot of people's minds.
Great. Yeah, that's a great question and something that we hear frequently. And I'll start, and maybe Evelyn, if you have something else to add, please do so. I think, again, the best way to address it is exactly kind of what I went through on the slide around mis and disinformation, which is really to understand, take the time to understand what the family's concern is, be empathetic, understand that they're asking these questions because they really do want what's best for their child's health. And then really to provide them with information that is from credible sources. So CDC, we have information on frequently asked questions that can help guide a response to that. I know AAP and others have also put out information, but that really helps debunk that there was one study that was done that showed this, and since then that study had to be retracted. There have been numerous studies that have looked into this question since that time, and we have not found any correlation between vaccines and autism. And so I guess that's what I would say is to, again, just to be empathetic, to listen, and then to make sure to provide credible sources of information. Anything to add, Dr.
I
Twentyman?
totally agree, and I will add only just to continue the conversation. One of the things that's so amazing about your relationship with the families that you serve is exactly that, your relationship. If you can establish and continue a conversation over time, what we've actually seen in our research is that sometimes parents that don't accept vaccination for their children on a first recommendation do on a second or third or fourth. So don't give up on offering this critical protection for those kiddos and continue that conversation.
Wonderful answers. Thank you, Kathleen and Evelyn. Next question. Can you speak on the woman who just received 3 vaccinations at once and broke out in a terrible rash and swelling all over her face and has been in the hospital for days? This situation is going viral right now. No pun intended, but I think I actually saw something about this just in my social feed as well. And Kathleen or Evelyn, I don't know if you have anything to speak about on this particular piece of information.
Well, I will be happy to take this question. It is an important one because it's basically a question about vaccine safety. I will say that to me, this sounds like anaphylaxis perhaps, and that's a big deal. It's extremely rare, but that is important to treat well and quickly. So I'm glad that she's getting good care. I will furthermore say anaphylaxis is, well, I've said it's super rare, but let me elaborate how rare following vaccination. It has not been observed following RSV vaccination at all. And then for flu and COVID, it's somewhere between 4 and 9 cases per million. So this is an extremely rare, well under 1% phenomenon. Most cases happen early while folks are still in the clinic where they got their vaccine. And most cases are quickly resolved with the medications that we use to treat anaphylaxis. Now, to speak a little bit more broadly about vaccine safety, the vaccines that we have today have been observed over hundreds of millions of doses under the most intensive safety surveillance vaccine program in United States history. So I do think that you can be confident that the vaccines that we have to offer are safe, they're effective, and they can protect the families that we serve.
Thank you very much, because that is certainly something that if it's out there, people are talking about it, and we want to be able to address it. Next question, RSV Abruzio vaccine given at 32 through 36 weeks pregnant. Is that with each pregnancy if it falls in September through January? And I know the answer to this question, but I'm going to let Kathleen or Evelyn answer it.
I'll take this one. No, it's just the first pregnancy or the first time a woman has received a vaccine. In subsequent pregnancies, we would not vaccinate mom. We would give the subsequently born baby Nursivimab. So I hope that that helps clear that up.
It does. And I know that's something that even those of us who work in vaccines all the time got to keep it all straight. So thank you for that clarification. So we have a couple other questions in the Q&A, but unfortunately we are out of time. But we will do this. We will make sure that those get answered in the recap email that's going to be sent around to all of the webinar participants next week. So I just want to again end and echo what everyone else has already said here. Thank you, thank you, thank you, WIC staff, for all of the wonderful, amazing, important work that you do each and every day in serving clients. It is invaluable, and we thank you so much for participating in our 2024 immunization webinar. And again, please look for that recap email that we will be sending to your inbox next week. Thank you all. Stay healthy, stay well, and thank you for being here.